everyone. I'm Beth Sanders. I'm the founder and CEO of LifeBio, and we're an age tech company serving healthcare payers and providers who help seniors facing loneliness, depression, and Alzheimer's disease. We provide a social engagement, a reminiscence, and storytelling platform that's done online and by phone to improve mental health outcomes and to reduce depression and other problems. So I'd love to share a little more about it here. It came out of my relationship actually with my own grandmother. I helped her tell her story years ago, and she was facing dementia. And today, 61 million Americans age 65 plus are facing loneliness. Actually, 43% of seniors face loneliness. 11% of seniors face depression. 10% of seniors are experiencing Alzheimer's and dementia like my grandmother was. And many people, 5% of seniors are living in nursing homes or assisted living and need a lot of care, need a lot of people to know who they are, basically. So LifeBio is looking at these costly conditions for payers and providers and addressing this. So these big mental health issues include loneliness, $6.7 billion problem for Medicare, depression, $53 billion problem for Medicare, Alzheimer's and dementia is costing Medicare $155 billion. So, by the way, interesting that loneliness actually leads to higher rates of depression and Alzheimer's disease, and of course other conditions like cardiovascular health are poor diabetes. So LifeBio has created an online reminiscence therapy and life story platform, and we're in the midst of adding artificial intelligence and machine learning. This is such a humanizing thing that we're doing in healthcare. Of course, there's amazing ways that artificial intelligence and machine learning can enhance this. Essentially, we see every person, including my grandmother and every other senior in this world, will do better and have better mental health if they have a chance to tell and share their life story. And these can be done in a variety of different templates that are provided online and in our app. And then new in 2020, we brought out My Hello Line, which is the digital platform for live social engagement by phone to reduce loneliness. This has actually been in the works for a couple of years. It just happened to come out during a pandemic where people are more isolated and lonely than ever. So we're matching agents to seniors, and we're also matching senior to senior. I can basically say it's kind of like Match.com for 90-year-olds. We actually have a digital way of connecting them, and they're able to reduce each other's loneliness, which is a powerful thing. So everything we're doing is very scalable, and we're using AI and machine learning as we go forward. In the world of memory care, I just want to touch on the fact that we have to know the person, especially in memory care. We have to know the person, we have to know the patient. So it's our vision that you will know who people are in the future. And that's happening for us via our online platform or through the phone-based system. Our outcomes are remarkable. We have been able to reduce loneliness and increase social support with our project with United Healthcare, and Optum has done research on this, and that research continues forward. We have had the largest study of reminiscence therapy in nursing homes, and we reduced depression by 15%. We improve efficiency and effectiveness of care staff in Alzheimer's and memory care units, and we were able to increase happiness and subjective well-being. So amazing outcomes, and this is something that's been done over the years, but we've been able to really figure out how to scale it and use it in a variety of settings. So it's a $4 billion worldwide market, a $1.2 billion US market. We all know the senior population is huge, 61 million today, growing to 70 million. So it's time to take care of our elders the best way we can, and we are the way to do that. We've got these amazing clients we're working with already, over 100 clients that are paying, everything from payers to providers to government agencies, even universities, and are on board. An incredible team of people, and just so excited for our AI new providers and our research partners. So we've just, we live and breathe this. It's an amazing team. We're growing it through a SaaS and PM model. So we're working with all different types of providers. Medicare Advantage can pay for this as a social need. There's project-based revenue happening. so LifeBio will move into the wellness space. And then I just want to announce we're very close. We think we're going to win a very large federal grant, an SBIR phase 2 grant. We're almost there, almost across the finish line. It's very exciting. So our revenues were nearly $1 million last year. This is a bootstrapped company, and we're growing, and we're a women-owned business in Central Ohio. So we see great things ahead, and here's our revenue. And we're raising $9 million for sales and marketing, programming, and ops support. That's about it.
Awesome. Great job, Beth. A few questions coming in. What's the ratio of AI to human agents? It's a question from Esther. She also asked about diversity on the team in terms of race and I'm sure gender and all those things.
Yeah. So at this point, the AI project is just getting started. So at this point, it's human to human, all human to human at this point. But we see the future, and especially see the future of the online platform helping us process the information. A human being is so complicated, and so getting 80 years of life into something that a provider could easily read is how we see AI being incredibly helpful right now, taking all this information, summarizing it in a beautiful way, and making it easier, especially to take care of people with dementia, using that approach. And we love human to human. We want real people. Okay, on diversity, I live, I guess right around us. We live out in the country outside of Columbus, Ohio. So, but in this open world that we live in now, where we don't feel like we need people in our neighborhood hired anymore, I'm excited that we can expand, especially as we hire for more AI and COO positions. Our diversity is definitely going to grow, and we think that's very important.
Awesome. So who are the agents for My Hello Line, Beth? And let's see this question. How do you see the positive impact of the platform flowing both directions, helping seniors and the agent in kind of a bidirectional communication?
You know, what's really remarkable is being able to bring people out of retirement to work for us as agents on My Hello Line. How beautiful it is to have somebody about 60 to 65. And they have been impacted. In fact, Wanda just this week said, I just got off the phone with an 82-year-old who's out walking every day, is going to this and that, is really tech savvy. And my agent was like, I really need to step it up here. I thought I'm retired, you know, but she's totally been inspired by the amazing people that we talk to that are incredibly full of life.
Yeah. And actually, some really great questions coming in. I guess, how do you protect 90-year-olds from bad actors? So people posing as another 90-year-old, so really kind of quality control, making sure that people are, do you have any protocols for that?
Completely. Like we're auditing the calls. Everyone is being vetted before, as they go through this process and go through training, and there's, you know, background checks happening, and so we can protect them. Yes, very important. And rematch them. If you see any problem at all, it's immediately, they can say they have a problem, or they can, we can hear there's a problem, you know, because people have certain things they can get along about, and sometimes they need rematched. They're just never going to agree on this, that, and the other thing, and it's going to be a problem. But they'll talk for an hour or 2 hours once a week at least with each other and contact each other. Their numbers are masked too, so it's all happening digitally. And anyway, it's being watched carefully. It's very important.
That's so important.
We're completely being completely HIPAA compliant, of course, is key.
Great question here from Alex Efron. Through these interactions, do agents glean any information that could be relevant to disease management or clinical interventions? Are there any protocols around like flagging for risk or anything that they're learning, or even integrating with a care team?
Yes, we see that heading that direction now. We're able to alert the payer when we see a problem. You know, if we're sensing something we have a protocol for reporting that to them, but I can see many, many ways that we could be more integrated as we go forward. And then there's, we're also integrating with electronic health record systems so that data can flow to them.